So in the third section of our lecture, which is also the final section, we will discuss about the metastatic and the benign tumor of the liver and biliary tree. And in this we will talk about the carcinoma of the ampulla of the water. Then we use tumors metastatic to the liver and then benign liver tumors. So carcinoma of the ampulla of water we have, it's 90% of the cases this carcinoma is the adenocarcinoma. So I mentioned that this is the area where the biliary tree or biliary duct enters into the duodenum, which is the first part of the small intestine. So it's 90% of the cases is adenocarcinoma. Loco-regional lymph nodes are involved in this carcinoma. CT scan, MRI and MRCP, which is magnetic resonance cholangiopancreatography, and CT and MRI are performed for the diagnosis of the carcinoma of the ampulla of water. Treatment is the pylorus-sparing pancreaticoduodenectomy. So pancreas should be removed and also the duodenum is removed because it opens into the duodenum and the pylorus is spared. So pylorus sparing pancreaticoduodenectomy is performed for the treatment of this carcinoma. Chemotherapy is performed. Then some features of the carcinoma of the ampulla of water, we have jaundice, which is, you can see the yellow discoloration of the skin, and this is very, very bad patient, jaundice patient, because all the face and eyes are yellow in color. So jaundice, which is due to increased level of bilirubin, is present in this carcinoma. Pruritus, itching is so bad, you can see the whole skin become red, and even there is slowly scarring and ulcerations are formed because of the bad itching and pruritus. Weight loss is also common. Epigastric pain is present in these patients. So these are some features that are present in the patient with the carcinoma of the ampulla. Then some tumors that are metastatic to the liver, tumors which can metastasize to the liver from different parts of the body. It's from the colon, pancreas and the breast carcinomas can metastasize to the liver. Colon is the large intestine, then we have pancreas, very closely related, and then carcinoma of the breast also spread to the liver. Then we have ocular melanomas. Ocular is for the eyes, so ocular melanomas can also metastasize to the liver. Colorectal and breast hepatic metastasis, again colon, breast commonly metastasize to the liver, and you can see there's the hepatic carcinoma, the nodularity of the liver. When the liver, you feel it with the carcinomas, is very rough structure and it's nodular, and you can tell by the palpation that the liver is not smooth and regular anymore. Treatment is the hepatic arterial infusion chemotherapy. So chemotherapy is infused into the hepatic artery for the treatment. Then other drugs like systemic drugs that can be used systemically, we have oxaliplatin. 90 yttrium resin beads are also used, and then we have palliation from chemoembolization, PEI and radio frequency ablation. So these are different treatment options. It's used for the palliation therapy and palliation from chemoembolization, in which we use PEI and RFA. So these are the treatment options for the tumor which are metastasized to the liver. So hepatic arterial infusion chemotherapy, systemic drugs, 90 yttrium resin beads, and also palliation therapy from chemoembolization. Benign liver tumors, which are the benign, not malignant tumors. Benign tumors are localized type of tumors. They do not metastasize to distant sites. So the benign liver tumors are the hemangiomas. Omas are for the tumors. Hemangio is for the blood. So these are the benign tumors that develop from the vessels. And then adenomas from the glands. They are 8 to 15 centimeter, well defined. Benign tumors are always more well defined, localized type of tumor, easy to remove, easy to treat. So these are the pictures of localized tumors of the liver, hemangiomas and adenomas. They are focal. There is focal nodular hyperplasia, excessive growth. Hyperplasia is the excessive growth or excessive cellular proliferation. There is also pain and bleeding with these benign liver tumors. Adenomas and hepatocellular carcinomas. Adenomas are vascular and hemorrhagic type of tumors. There is hemorrhage, bleeding in these tumors. The diagnosis of benign liver tumor is triphasic CT scan is performed. Tri means 3, so it's in the 3 phases CT scan. HCC, hepatocellular carcinoma, fast bolus protocol, which is arterial phase imaging is performed. Then we have delayed venous phase imaging is done, and MRI is more sensitive for FNH. So this was all about the topic in which we talked about the tumors of the liver and the biliary tree, and we talked in detail about the primary tumors of the liver. Then we discussed the cholangiocarcinoma. Primary tumors of the liver were the fibrolamellar type of the tumor, and then also we discussed the endotheliomas, hemangioendotheliomas, and both of these types, if you remember, that they are not associated with the cirrhosis of the liver. Cirrhosis is not present, and usually liver function test is normal in these type of tumors. Then in cholangiocarcinoma, the prognosis is very poor, survival rate is poor, and then the cholangiocarcinoma is the tumor of the, or carcinoma of the biliary tree, which is the tree or tract that carries the bile from the liver, gallbladder, and carries it to the duodenum, which is the first part of the small intestine. Then we talked about the carcinoma and malignancy of the metastatic tumor, and then the benign tumors of the liver. Metastatic tumors which can metastasize to the liver are from the colon mainly, and from the pancreas and the breast cancers. All these cancers from the breast, Then we talked about the pancreas and the colon. They are metastasized to the liver. And then we have other benign tumors, which are hemangiomas, adenomas, that are localized tumor, and they are easily removed and treated. Then we talked about different diagnostic tests that can be performed to diagnose these tumors and the cancers, in which MRCP, ERCP, then we talked about CT scan, MRI. The very important is the detection of the tumor markers, which are the CEA, CA 19-9, and also the different type of biopsy. Biopsy is also very important along with the tumor markers. So all that we discussed in our today's lecture, and that was all about our topic, the tumors of the liver and the biliary tree. Thank you for watching sqadia.com.